Can everyone hear me? Oh,
Yes.
yay. And I only hear me once, which is also good, not in duplicate. Happy days. All right. What we are going to do starting now is to walk through the bill section by section and talk about it. And I want to start by thanking Naomi and Deb, not just for the presentation they just gave, but once session ended, although I had listened to all of the testimony on this bill, it changed quite a bit in the last week or so. I hadn't caught all the changes. So they are the two who came to me with Lynn, you know that it's your program, Safety Oversight and Quality, that's implementing this, right? And I said, right. So jumping into that, they've been very helpful in giving me background on the sections. I've now taken that and put it into a document that we're going to walk through today. But also each of you was sent a copy of the bill. So you've got the bill in its entirety. That was the third document that I attached to the meeting notification. So if you want to pull that up on one screen and you can really read right along, because what we're providing now is a summary. And although some of the language is verbatim, some of it is a summary of what's in the bill. So if you want the full language, please do pull up the bill as well. Kim, are you with me and have you recovered connectivity? And hi, there's
Yeah.
Kim.
Yeah.
Wonderful.
Lynn, I wanted
Okay.
to let you know that in order to be able to share my screen so everyone can see, there's going to be sections where I'm not going to be able to type and share. So I'm typing on a separate screen where some of the sections are longer, and I'll do a copy and paste into the document as the comments are finished. So wanted to let you know that.
Thank you.
Yeah.
That makes sense. Wonderful. Okay, thank you. Well, let's start sharing and we will start talking about the bill. Okay, to start with, Senate Bill 99 was just passed this year, so during the session of 2023. And then it did give us the deadline. The first deadline is, of course, January for some of the pieces to be in place. We're going to walk through this and just explain each of the sections. Section 1 of this bill, and I should say the purpose is really called, and they'll put titles into bills sometimes initially. You don't see those titles when the legislation is finally produced as a statute or the Oregon Revised Statutes. But for right now, it does still have the title on it, that title being Bill of Rights for LGBTQIA 2S plus older adult residents of long-term and community-based care facilities. So that is the working title, even though I will say it actually goes a little beyond just what the title says, because they did also mean to include adult foster homes. So anyway, and that title actually only long-term specifically addresses nursing facilities, and then of course residential care actually generally applies to community-based facilities and assisted living. All right. If you have any questions while I'm talking, please raise your hand. I would rather address your issues in the moment, because first, there are probably others thinking the same thing. But second, it's just easier for the flow to address questions as we go along. So please go ahead and raise your hand if you have questions during the presentation. I will count on Ann largely to be the one to make sure that I see it or that I respond. So, but that's an open invitation while we walk through the bill. Section 1 of the bill, all that section does is say, this language that you were writing, we want it to be in that statutory section. And what that section is in ORS, Oregon Revised Statute. Liz has a question. I'm going to stop right there. Liz, what's your question or comment?
Yeah, I'm going to, sorry, I was trying to get to make sure I had the right language. There's another title that I use to refer to this bill. I'm going to drop it into chat because this bill also provides protections for people living with HIV. So I'm just going to drop it in chat. I don't know how flexible changing this part of it is, but I think that's really important.
Very good point. Good point. Yes, I realized as I was reading the bill carefully, you're right. It's not just the community, but it's also folks with HIV. I've just lost the presentation. Or have others lost it, or is that just me?
It's not currently presenting, so we'll get that screen back up.
Okay.
Kim let
Okay,
us know
got
that, yeah, her connection dropped off again. I'm
I
sorry.
know she was having connectivity problems earlier. I had then said to David, I was going to tap him to then take that on if that's happening again. Is that happening?
That is
right now?
happening again.
Okay, so is this Kim or is this David? Who's running
This
the
is David
screen right
sharing
now?
the screen. Do I have the correct document
Thank
up?
you. You do indeed, my friend. And
All right.
I know exactly what Kim was saying, which was some of the comments she might write on separate pages. What I'm going to ask right now, can you bump the size up, please,
Yes,
to
yes.
make it a little easier? You know, my eyes, at least I can't see a thing, so that always helps. Wonderful. And then as we go through the bill, I would suggest that what you do is just under comments and suggestions, I've started each section with what I would do as the agency person. And so I get an idea of how we write the rules. And then on any other bullets, I'm hoping you would capture the initials of the person making the comment and then include a summary of the comment.
Understood.
If that makes sense. Thank you. Thank you. So moving on to section 2. Section 2, I did not include in its entirety right here. So if you want to look at the bill, please do that to see it. But what all that it is, it's the definitional section, and it includes 11 definitions, which I did list here. They are definitions for what is a care facility, what is gender expression, gender identity, gender nonconforming, gender transition, harass or harassment, LGBTQIA2S+. Oh, hello, something just happened. Resident, let's see, sexual orientation, staff or staff person, and transgender. Now, what we normally do as an agency, if we're looking at a list of definitions that have been specifically spelled out in the bill, hello, cat. I now have a cat deciding to join the discussion. That's not helpful, sweetheart. What we do is take that verbatim. We put it into our rules, and we require facilities to do the same. So unless there's something about any of those definitions that is unclear, and I expect that we're going to start in on that with a lot of detail in the next meeting. But if any of you who've been working with the bill are aware of language that you don't like right now, or anything you think we need to include to further explain any of what's in the bill, we can do that. And I see Eugenia. Your hand is up. Yes.
I just want to flag as we incorporate definitions into existing rules that the definition of staff for the purposes of this bill includes contracted individuals. So I just want to make sure, because we use staff pretty frequently in the existing assisted living rules and in the existing nursing facility rules. So we don't want to complicate things by saying staff. And if that term is used elsewhere, just be mindful that the way that it's phrased here, it includes contracted staff. So we may need to pull some things out or make sure there's a distinction.
Good comment. Thank you. Any other comments right now or questions? And David's connected again. So apparently we're all losing connectivity. Well, that's fun.
So I'm back. I'm calling out a comment from, let's see, Patty in the chat asking if the acronym will be spelled out. If the acronym you're referring to, Patty, is LGBTQIA2S, that will be in the definition section and then will be abbreviated throughout the rest of the rule, is my guess. Lynn, respond to that. Yes, confirmation.
Yes, that is a confirmation. And the term specifically is paragraph 7 of section 2 in the bill, which I do have up here. So I've got full language to my left. And it is spelled out, means lesbian, gay, bisexual, transgender, queer, intersex, asexual, two-spirit, non-binary, or other minority gender identity or sexual orientation. And I'm assuming that came from some of you who were part of the coalition and helped follow the bill through. But that is what the definition is right now in statute. And if there's anything wrong with that definition, do let us know. Okay, helpful comments. I'll let you finish doing that, and then we'll move on to section 3. Please, David, whenever you get a chance. All right, section 3, and I've taken, again, the first part of it, I just sort of said care facilities and staff, because that's who has to follow this. The rest of this section I took verbatim, because I thought this language was pretty useful. Care facilities and their staff, quote, may not take any of the following actions based in whole or in part on a resident's actual or perceived sexual orientation, gender identity, gender expression, or human immunodeficiency virus status. And it has quite a long list of things facilities cannot do. And if they do them, we would need to take action as the state. I will tell you right now, my inclination, this language looks pretty solid, is to include all of this verbatim in our rule and require facilities to include it verbatim in their internal policies. But I would be interested in knowing what okay, see, Liz gives me a thumbs up on that. I appreciate that. I looked at it and I thought, I don't want to mess with this. It's pretty clear. And yes, there's a lot there, but there needs to be a lot there. So my inclination is right now, as the state person who's the lead on this, is to include all of this verbatim in the language. If anyone has a problem with that and can explain why, I mean, I can understand it's lengthy, and it certainly will lengthen rules, and it's going to lengthen policy for facilities, but I think it's very solid information, and I'd really like to include all of it. So unless there's an issue. Okay, right now, let us continue, please, David. And Kristen.
We have a quick comment, yes.
Yes, got it. Kristen, your question?
Thank you, Lynn. I'm just wondering, as I continue to kind of reread the definition and seeing the LGBTQIA2S+, you know, obviously language that's referenced throughout. I'm wondering if there needs to be some clarity on that definition, or like, I'm trying to figure out how to word this. I'm not sure how many individuals know what like two-spirit is, and how, you know, they're almost definitions on the definitions, or a reference of where the appropriate place to go is to find those, because I'm not sure as a staff person I would know how I was serving those individuals, or if you know what I mean. I just think there might need to be definition of the definitions, or a very clear place to go to find those.
Sure. And while others are thinking about their responses, we can certainly do that. We do that in our definitional section, as you well know, of course, all the time, where we'll have a general statement such as this first sentence, and then after that we'll say, here is either where to find the definition for individual pieces of a rule, or it means blah, 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 and we explain it. I would like to know, for those of us who worked on drafting the bill, is that something that A, makes sense to you to add, and B, do you already have language available that we might be able to include to further define this, if that's something that would be a good thing to do? Give people a moment to think about that.
So Lynn, we have a comment. Oh, I apologize. It's Patty has indicated, Patty Falkenstein, that the acronym may also change in the future. And we have Liz James who commented, yes, a good idea, and add a glossary.
Okay, both are good points. To the first from Patty, you're right, it might change. And if that were to happen, that would be called a rule amendment process, which we do all the time as things change. So the problem we sometimes have, and I'm frankly trying to find a better way to track pieces that need to be amended, is staying on top of them so we know if they would change. This one would have to be a legislative change before we would change this definition. So if the legislature does indeed add on additional identities or characteristics, we would then add those as the legislature does that. For the second question, yes, we can include glossaries. We generally try to include all definitions in what's called our definitional sections. Each of the 3 programs, nursing facilities, adult foster homes, and community-based care, each of those has a definitional section that all of this would go into. So, and glossaries, although it's true, like survey teams use glossaries when they're out in the field. It's not something we normally put into rules, but interesting idea to think about. And I know David's got it down, so we'll think about that. Anne, go ahead. What are other comments?
There's quite a big chunk of information in the chat again that provided by Rayanne regarding inclusivity, whether or not this might be helpful, this text. Two-spirit is a term used by some Indigenous North American and First Nations people to describe individuals who embody both masculine and feminine qualities, often within a cultural or spiritual context. Here are some guidelines for serving two-spirit individuals respectively and respectfully and effectively.
And effectively.
Yes, and then it's pretty lengthy in the chat,
we
so
don't need
I just want to call that out. Sure.
Thank you. I do appreciate that. I guess what I would be looking for is feedback to this language if folks have any or think that it either should be shorter or this isn't accurate. That's the kind of information that we would need as we go forward. But thank you, Rayanne, for including all this. It's very helpful. And you're right, it does have a lot of these terms, at least defined with a little bit more detail.
There is another comment. Oh, there's another comment just quickly.
Okay, go ahead, Anne. Yeah.
Kurt Toombs has said in the chat, I hope sexual identities are listed and defined.
Got it. Thank you.
Okay.
Good comment. Okay. And then Kyle Rose with our adult foster home program is making the comment. The acronym is PREP for change, given the plus at the end, which is a good point. So it might well become longer, but very good point. And then Liz has offered, we're not at the training section, but included in the training should be definitions of LGBTQIA 2S+. Good point. So with that, good comment. Deb.
Yeah, can you hear me?
Mm-hmm.
Great. So I think that the department, us, can take a whack at, if you will, at adding some definitions. However, there is not always consensus in definition of all of the pieces of the LGBTQIA2S+ acronym, and so if those of you who are members, not to put you on the spot, but those of you who are members of the coalition or are representing other agencies and organizations would like to offer some of those definitions, that would be terrific, but this may be a place for some homework after the department has put some language in there. We want to make sure that that is acceptable language. There are challenges around definitions and language.
Thank you. Yes, I think there always are, but particularly here, we want to be very careful and we want to get it right. So we'll take some time and see if we can do that. Okay, David, can you go up a little bit, please, in section 3? A little bit more, and okay, stop there. So this is the first section, right? Okay, this is the paragraph 1 that we've already talked about, that list of things that facilities and staff are not allowed to do. And this again is a list that I'm, at least for right now, proposing we keep intact and move into the rule. Can you please scroll down now to section 2 or paragraph 2? Thank you, right there. Okay, paragraph 2. This is a section we're absolutely required to put straight into rule. And just so all of you know, it has to be used verbatim by facilities, and they need to post it as a notice with this verbatim language attached. So now over time, we may or may not learn that people want to expand on this definition, but for our purposes, if something in legislation says you have to use this exact language, state agency, that's what we have to do. So at this time, this will be the verbatim language that will be used by facilities and posted as a notice so that residents and family members, people visiting, will all see that exact same definition. David, are you able to scroll, or are you now having connectivity? What is going on here? We're all having a day.
I'm able to scroll. I was just saving the document.
Oh, thank you.
Let me know where you need to go,
sorry,
and thank you. It's all right.
Okay, thank you, sir. Yes, just please. Okay, stop. Whoops, go back up a little bit. Sorry. And a little bit more stop. I try to put comments and suggestions at the end of every section of the statute. And so you can see some of mine there. If you can scroll up just a little bit so they can get all of my first comment, that would be great. Good, great. That looks good. I need to ask the cat to move. Come on, baby. I can't see. Okay. So what I'm recommending as the state again was that we include both 1 and 2 verbatim in each of the 3 rule sections. And then send out provider guides to facilities explaining these requirements, and doing that fairly quickly because they are going to have to do some things in the near future. We also need to develop that required statement as a poster. We do it in a number of languages, I think 10 different languages. We also do others as requested. I admit I don't. We have another program that does that. Deb and Naomi, I think, know more about that right now than I do, but that's something that we as a state are required to do, so we will have those posters available for facilities to use. It is required that facilities give a copy of the poster to residents. I'm assuming that means you're posting it in the facility, maybe in several places, but again, exactly where they have to post, or do they hand it to facilities? We haven't had that discussion yet, so that can be part of this rule discussion. Okay, what else do we have? Licensing survey. We have both a nursing facility survey team here within Safety Oversight and Quality, and we have a community-based care survey team here within SOQ as well. And they go out and they survey looking for deficiencies in facilities. And they have a long litany of things they look at, but this information that's being required as part of the bill, that will indeed be added to that survey review. We also, I know, have surveyors who are reviewing surveying adult foster homes, but they're not in our agency, they're locally based. So I don't know, Eleni or Kyle or Lynette, if you want to talk at all about how that works, or if you just would like us to keep on and going. I can go either way.
It's effectively saying they just live locally, is all in support within their area.
Thank you. So they will then be adding to their survey process as the rule is increased or added to. And then I know that our then OPAs, the policy analysts, they're then training folks so that they know what to do and they understand any regulatory changes that are made here kind of in the central office. Okay. And then we have clarity needed on definition. Yep, exactly, especially Two-Spirit, AK, 2S, and RV added to chat. Okay, thank you for Rianne. There we go. So thank you, David, for managing to capture all that in spite of issues. I'm very grateful to you for that. Let us keep on and moving. Scrolling. All right. Starting in section 4, I started highlighting just keywords. So the bolding is not in the bill. That's just I sometimes do that so that I can immediately capture whatever is happening in that section. And for section 4, this is a requirement on the facilities stating that they shall implement procedures regarding maintaining confidentiality of resident records for the purpose of this bill specifically. Also states that unless required by state or federal law, a care facility shall not disclose any personally identifiable information regarding, then it's got the list of 4 items. A resident's sexual orientation. B, whether a resident is LGBTQIA 2S+. C, a resident's gender transition status. Or D, a resident's human immune deficiency, why do I have trouble with that today? Virus status. So as Liz mentioned at the beginning, this bill is not focused just on the LBT issues, but also on the HIV status. So we have to remember that and ensure that that's also in the language. Continuing on this section, a care facility shall take appropriate steps to minimize the likelihood of inadvertent or accidental disclosure of information that's described above. And in paragraph 4, there will need to be informed consent must be required in relation to any non-therapeutic examination or observation or treatment provided to a resident. 5, a transgender resident shall be provided to any assessments, therapies, and treatments that are recommended by the resident's healthcare provider, including but not limited to transgender-related medical care, hormone therapy, and supportive counseling. So what we will be doing is requiring that the facilities include this information in their own rules. It will be up to this group to decide if we want to use the language as is or if we'd like to define it further. And I'm just letting you know that now. I'm thinking want to define it a bit, but I'd like to open it up a little bit and see what maybe others think. So Anne, is there anything in the chat that I should be aware of right now? Anything you can read to us or point me to?
Well, essentially, David's been posting those as comments, the chat comments, so there's really no questions. The comments have been incorporated in the notes.
David Speedy, appreciate it.
There did just arrive a comment from Kristen Milligan, and it says, to be clear on my comment, I use 2S as an example. However, I'd request definitions be made available for each. So that just arrived.
And thank you, and do agree with that. Thank you. Okay, then the other questions were what, just so I know. At the least from Patty, the facility should post the poster in a common room. Yep, where it will be easily seen. Very good point. And then Liz was saying concerning the 2S resource, the NARA Northwest. Michelle Pinkham, thank you. A reference, a person I can go to get that language. Appreciate that. And then Liz had made a comment earlier, we're not at the training section. Okay, we'd already talked about that, but the training should include these definitions. Very true. All right, then, thank you. Are we then at the end of section 4? Was that the one that we're in? Thank you. And I'm betting you managed to capture all of that because you're good at that. So are we ready to then move on to section 5? Thank you. Let's do that. Okay, section 5. This is one that will probably end up looking a little different, at least in terms of our program here in Safety, Oversight, and Quality, a little different in each of our 3 programs. Just because nursing facility has a slightly different, because they're more under the federal law from CMS, Centers for Medicaid and Medicare. They have a slightly different process than we've got, say, in community-based care or in adult foster homes. So we're going to be looking at that, but I do see a hand up. So let's go to whomever. See, I'm going to get over with people.
Comment from
Carrie.
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 Hi, Carrie. Yes.
Dowling.
Carrie, please. What's your comment?
Hi, thank you. I'm one step behind. On section 4, number 5, can you hear me okay?
Yes.
Okay. When it talks about transgender residents should be provided access to any assessments and therapies or treatments that are recommended by the resident's healthcare provider. I'm wondering if we can expand that because that feels really limiting, like that they could only have access if their healthcare provider recommends it. If there's other therapies or groups or things that they would find therapeutic, they should be having their own self-agency to self-refer to those treatments or therapies without the need to have a doctor say yes to it. I hope that I'm making sense with that.
You're making perfect sense, and I think we can add additional information. Here's why. Because if you look at paragraph 5, at the end of it, it says it gives the list that are recommended by the healthcare provider, including but not limited to. So we are able to add additional things to that language because we're not limited by the statute. So thank you for that. If you can start helping us with that information or exactly what the wording would look like, that's the kind of thing we'll start working on for the next the next meeting. But thank you. We can
Okay.
definitely do that. It's a great suggestion.
Thank you.
Kurt. Yeah, thank you. Kurt, do you have a question?
Thank you, Lynn. Kurt Toombs with Eastern Oregon Center for Independent Living, and I'm not sure if it fits here, but not just the healthcare provider, but people that are living with HIV need to be connected with Oregon Public Health, Ryan White Case Management, because they're paired with, they're assigned to a program that provides case management services that has the AIDS accredited nurses, which these facilities will not have that expertise. And so we don't want to silo people just to their medical provider. We want to get them to public health and get those resources that are available. And that also goes with the training. These providers probably should not be establishing the training around the needs for people with living with HIV. Public health already has those training modules available. But it's very important that they work with the case management providers and Oregon Public Health to provide the services to the individuals living with HIV. Thank you.
Thank you. No, that's a very useful comment. We have two possibilities. Yeah, we can look at how to add this. My brain immediately goes to how would I include that, right? What do I have to amend or what we change? I think we can include that. Again, with that including but not limited to, and although I know it says is recommended by the resident's healthcare provider, for the purposes of this bill and this part of the rule, we may be able to expand or describe what that is more fully for this community. And I think there's a way to do that. So anyway, my little brain is going, but thank you so much for that comment. Any other comments on section 4? All right, then let us scroll down, please. There you go to section 5. You're just so good at that. This is a section directed very specifically at the department, and it says and the facilities. If a facility violates these provisions that have already been stated in this law, or employs a staff member who violates any of the provisions, they shall be subject to civil penalties or other administrative action as may be provided under.
We lost your volume.
We'll let you know when it's back. Keep talking just a little bit. No worries. We know this drill.
Okay, I'm going to try to come off mute.
You're back.
All right, I'm just going to try this for a while without the headset. I'll let you know for everyone. The reason I've been using a headset is my system loves to check out every once in a while in the middle of meetings, and this was not a meeting where I really wanted to lose any of you. So if I do, I may need to take a break and try to reconnect through the phone, but for now we'll just do it the old-fashioned way, and I will just talk at you normally. All right. So what this section of the bill is this section is telling us as a department what we need to do, and it's giving us okay, just to get off that. Okay, and it's saying the department may not be construed to limit the ability to bring any civil, criminal, or administrative action for conduct constituting a violation of any other provision of law. That's very useful. That's something that for folks living in facilities or their loved ones or family members, they would be able to, or representatives, they could bring an action under that might not just conform with our rules and statutes. So that's the reason for that being there. It makes sure that it's not a limited section that only applies to our department. Are there questions or comments about that?
You do have a comment in the chat.
At this point, what we, the agency, will be doing is saying, all right, for each of the 3 programs, exactly what would you need to amend in your civil penalty section to include this type of a violation? So, and as it states all there, it says subject to civil penalties or other administrative action, because we have a sort of a range of actions that we can take, not just requiring money, but sometimes we require other pieces of information, or we require people to just fix the problem, and it's part of a different setup, a regulatory device. Any questions or comments about this section?
I'm just noting
Okay,
that
not
Carrie's
seeing anything
comment.
right now, so let's go ahead and move on, please, to section 6.
I don't think she can hear us, which might be
Is
an
there, oh,
issue.
Liz has a comment. Thank you. I saw David make a motion and I went, okay, there's Liz. Yes.
I'm
Liz,
sorry.
comment,
I
question?
Yeah, I don't mean to hog the discourse, but I was just curious.
Please tell me she's now on mute, or does it mean I'm totally out of it?
It's you.
It's me?
Mm-hmm.
Oh, that's
Can you hear me
sad.
now?
She's having headset issues, Liz. Let's just give her a moment.
Okay.
Let me know if you can hear me.
Yeah.
Yeah, Liz, all of us can hear you.
Can you hear me?
We can hear, yes.
We're going to take a break now, and I'm going to
Okay.
figure this out. And we're going to come back in 10 minutes. So you've got a second break.
Okay.
Let's see. Let's go from 11 to 11:10. And we'll come back and see you then. Thank you.
Okay.
Bye. If you can hear me, I'm going to leave and try to come back.